I see many women with hair loss. Probably 30% of our practice consists of female patients. There's a societal and psychological burden that women face that men don't always face when they encounter hair loss. I'm very compassionate and empathic about the treatment of women with hair loss. As part of the initial evaluation of patients that come in with hair loss, and particularly women with hair loss, we kind of do a deep dive in terms of medical reasons that may contribute to hair loss. Sometimes blood work is needed to evaluate the thyroid, or if there's a concern about anemia or hormonal imbalances that may contribute. So we take an overall medical approach before pursuing a surgical solution. I'm here with my patient Katrina. Katrina had a hair transplant with me about 2 years ago. Many women sustain hair loss in an angular androgenic pattern around the time of menopause, and that's very, very common. And many women don't know that there are solutions for this hair loss that can occur. The hair loss really was frontal. You know, you had a lot of loss, and it became a really angular pattern, like a, if you will, male pattern. And so what we did was soften this. And let me come around you behind you here for a second. On both sides, instead of having this angular pattern, which we can look at in the pictures in a second, this is all transplanted hair now. So if we look closely at the transplant, the real goal of transplantation for everybody is to create a natural appearance.
Yep.
And specifically, when we do hair transplant in women, we try to create a soft, feminized, rounder hairline. And so that's really what I want to show others here. So if you look closely, this is all transplanted hair. We brought the hairline down slightly in the center, but this whole angular recession here is now constituted by transplanted hair. It's a very gratifying part of my job when I see people come back and express how they're doing and ultimately how hair transplant has affected them in a positive way. And the paradox is that they don't think about their hair transplant. The people they encounter don't say, great hair transplant. They just say, you're looking good, or there's a certain air of confidence about you.
After the new hair had come back in, it was just fantastic because I could, again, put my hair back, use a hair clip, what do you call it, headband, and not, I was always embarrassed before I had this done. I couldn't, if the wind blew, I was embarrassed. Now it doesn't matter, and it just made a huge difference in my self-confidence.
Initial therapy for women with hair loss can be multifaceted. Generally, hair transplantation is the last option, not the first option, and there are substantial advancements in the field of medical management that we bring to bear to help women with hair loss. Some of these are oral tablets, some are topical. We also use low-level laser therapy or photobiomodulation. And I'm very excited to be able to use injectable growth factors when it's appropriate for women with hair loss.